Genital herpes, labial herpes, herpetic lesion are group erythematous vesicles that progress to painful ulcers. Herpes simplex virus infections can be caused by herpes simplex virus type 1 and herpes simplex virus type 2. Herpes simplex virus infection typically manifests as oral, genital, or cutaneous lesions composed of painful group erythematous vesicles that progress to ulcers. Etiology of genital herpes most commonly is herpes simplex virus type 2. Incubation period is 4 to 7 days. Clinical features. Affected individuals are often asymptomatic or have mild symptoms but may still be at risk of transmission. Skin lesions may be present in both initial and recurrent infection. Initially, redness, swelling, tingling, pain, pruritus. Herpetic lesions are grouped erythematous vesicles that progress to painful ulcers in the anogenital area. Primary infection. As it is a sexually transmitted disease, primary infection site is genital tract, skin lesions in the anogenital area, cervicitis, white thick and or foul smelling vaginal discharge, urinary tract, dysuria, urethritis, associated symptoms, fever, headaches, myalgias, malaise, tender bilateral inguinal lymphadenopathy. Clinical features of recurrent infection: prodromal symptoms lasting hours to days, pain or tingling in the genitals, legs, buttocks, and/or hips. Skin lesions are usually unilateral, less painful, and of shorter duration than in the initial infection. Genital herpes, penile shaft and glands. Two ulcerated blisters with erythematous margins are visible proximal to the corona of the glands. Genital herpes. The entire genital area appears erythematous with an inflamed vaginal vestibule and urinary erythematous. Solitary erythematous papules are visible inside the labia minora. Furthermore, there are white purulent lesions in the vaginal introitus. These findings are consistent with genital herpes, most likely caused by infection with herpes simplex virus type 2. Diagnosis: if lesions are present, make an initial clinical diagnosis to facilitate timely empiric treatment. Obtain lab confirmation by PCR, first line, or viral culture. Viral culture gives clue about antiviral sensitivity. If lesions are absent, obtain type-specific herpes simplex virus serological testing, type-specific to differentiate between herpes simplex virus 1 and herpes simplex virus 2. Treatment for genital herpes: treatment of initial infection is cyclovir, famciclovir, valcyclovir. Treatment of genital herpes for recurrent episode is cyclovir, famciclovir, valcyclovir. You can copy the doses by pausing the video. Also consult the patient on safe sex practices and sexually transmitted infection prevention. Labial herpes. The etiology of labial herpes most commonly is herpes simplex virus 1. Epidemiology: labial herpes is most common recurrent herpes simplex virus infection. Clinical features: erythematous vesicles on the lip or vermilion border that progress to ulcerations. Prodromal symptoms lasting up to 6 hours. Pain, tingling, burning sensation. Diagnosis of labial herpes: if lesions are present, make an initial clinical diagnosis to facilitate timely empiric treatment. Obtain lab confirmation by PCR or viral culture. If lesions are absent, obtain type-specific herpes simplex virus serological testing. Treatment: oral valcyclovir, acyclovir, topical docosanol, acyclovir. Topical treatments are less effective than oral treatments for labial herpes. You can copy the doses of drugs pausing the video. Herpes labialis. Multiple vesicles on an erythematous base can be seen on the lower lip. This is the characteristic appearance of herpes labialis. Thank you.